After studying this module, you shall be able to learn about health and related aspects, identify the determinants of health, evaluate the National Health Policy 2015, learn the objectives of health policy and identify its limitation. Health dimensions of macroeconomic development, which is health policy. Educated, skilled, healthy and trained population of a country becomes its human resource or human capital. It is universally recognized that human capital is a vital component of economic growth. A country cannot maintain sustained and continuous growth without a labor force with the minimum levels of education and health. All societies value good health. The concept of equity in health and equal right to use health care is based on an ethical notion of fairness. A healthy population is an asset for the country. Health is a fundamental component of human capital. Cross-country macroeconomic studies suggest that health positively affects growth. For example, an increase in life expectancy from 50 to 70 years, a 40% increase would raise the growth rate by 1.4 percentage points per year. A 10% fall in malaria is associated with an increased annual growth of 0.3%, and malnutrition causes a decrease in the annual GDP per capita growth worldwide of between 0.23 and 4.7%. Using mortality rates and expectancy of life as health indicators for different age groups, many studies have estimated direct relationship between health and growth, indicating that health is responsible for a substantial portion of long-term economic growth. Analysis and research has found that economic development can contribute to better health and nutrition. Also, we can believe the relationship to be working in other directions as well. Wealthier countries have more resources and therefore greater capability to invest in medical care and public health measures. The allocation of health resources should be done for achieving the following three objectives: equitable distribution of an optimal level of health status, highest possible level of health benefits, and adequate amount of financial risk protection for all. Health and related aspects. Health improvements can contribute to economic development. Health improvements can certainly boost economic progress. Health improvements can contribute to economic development through family welfare and family planning. Investments in family welfare and reproductive and sexual health can help reduce family size and reduce poverty. Investments in health may lead to demographic changes conducive to economic development. These changes may enhance a period with high ratio of workers to dependents, leading to increased national savings. Small and healthy families ought to increase savings and investment. Improve productivity. Better health can make workers more productive through increased output of fewer days off or while working. Improved health of family members will have a similar impact through reducing time lost to caring for dependents. Improved learning. Studies show that good health and reduced diseases, particularly in early childhood, helps in improved cognitive development and enhances the ability to learn. Healthy children will also be more regular in school. Enhanced learning through either of these mechanisms will add to human capital, which is an important determinant of economic growth. Health and investment. A healthy and better educated workforce may attract more investment from both national and international companies. Reduce treatment burden. By preventing certain illnesses or providing for the early treatment of the disease, the cost associated with the same can be brought down. The same capital can be used in productive activities like investment in infrastructure, education, etc. Role of government towards equitable financing and distribution of essentials of good health. Globalization and privatization has let the private players capture large chunk of health services market with the view of earning profits. Even though they help in improving the efficiency of this sector, it remains essentially the role of the government to finance and distribute basic health goods equitably, especially in the context of poor and developing economies, so that the health benefit reaches the grassroots level. The government should provide primary care and hospital services for the poor at subsidized rates, monitor market performance in health sector, provide basic and necessary education about the importance of health and hygiene to the consumer, provide free public and merit goods such as immunization, maternal and child health services, etc., establish a national and regional health insurance service for workers and their families, initiated with have some special policies for the vulnerable and aging population, as the aging of population is a serious problem emerging in both developing and advanced economies. Investing in health. The literature on health and economic growth has made it evident that the improvements of health of the population have contributed in reducing poverty and inequality in less developed countries or LDCs. Public health programs always create complementarities like education, longevity, or sustainable fertility rates for families. Investing in health brings multi-dimensional benefits to the society and adds to efficiency and productivity of workers. The concept of health, life expectancy is the health measure used in the Human Development Index. The concept of health. The question here is whether life expectancy is the right measure of population health on conceptual grounds. Both the quantity of lifespan and the quality are important indicator of HDI or Human Development Index. And healthy life is a vital aspect of quality life. There are a number of approaches to adjusting life years lived by health status to get a better measure that accounts for illnesses. One approach is to use quality adjusted life years, QALYs, where individuals express their preferences by valuing the quality of a life year lived in a state of ill health as the fraction of a year lived in full health that would give them the same utility. Another is to use disability adjusted life years or DALYs, where a life year lived with disability is considered equal to a fraction of a year lived in full health, with the adjustment being made by an expert panel. Both the above approaches represent different ways of thinking about welfare. Difficulties in measuring relationship between health and income. Measuring health is a difficult task. Health is measured differently in different studies. Macroeconomic studies use a variety of indicators, mainly focusing on mortality rate measures like life expectancy. The second problem is that of timing. The health effects in the macroeconomy have long time lags. This has been proved by studies showing long-term effects of early childhood health on cognitive and physical development that affects productivity of an adult. So the relationship between good health and income or growth has long time lags which make it difficult to be measured. The third issue is that of causality. Health and income have a two-way relationship. As income affects and health affects income, it becomes necessary to entangle the two directions of causality. Determinants of health. It is difficult to measure the direct impact of health on income levels, as there is a two-way causality between the two. Some studies like Preston in 1975 demonstrated a positive correlation between national income levels and life expectancy. Figure 1 shows the Preston curve for the data of 155 countries in 2005 on income and life expectancy. It may be due to the reason that higher income levels allow greater access to inputs that improve health through factors like nutritious food, clean water and sanitation, education, and medical care. Some economists are of the view that it is the health measures that may be in the form of improvement in health technologies. Public health measures of preventing the spread of infectious disease, etc., bring improvements in health. Health and welfare. It is a well-known fact that good health is an instrument of economic welfare. The contribution of health to human welfare means the direct welfare benefits of a long lifespan and good health. Investing large amounts is supported by the fact that there has been large monetary value of health gains through increase in productivity. Estimates of the monetary value of life, which is measured as the willingness to pay to avoid a small risk of death, are often very large. The income gain they would entail is a measure of value of health and longevity in money units and can be very large. Such comparisons suggest that in many countries, the value of health gains has been comparable to or has even surpassed the value of income gains. Health as a human capital. We can see a global transformation in human health with the multiple measures taken by the government and people of the countries. We are living more productive, healthier, and longer lives. Better health has boosted rates of economic growth worldwide. Lifespans have risen markedly in the last decades. The rise in life expectancy was evidenced first in Europe, followed by other parts of the world. But economists believe technical improvements were the reason for this change, particularly the discovery of the germ theory of disease, a better understanding of hygiene, and the development of antibiotics and vaccines. Literature provided us with a strong body of evidence showing that better health promises more rapid growth of GDP per capita. Let us explore the findings. It has been seen that a healthier, better, skilled and trained labor force is an asset to the society. Such workforce not only innovates new technology but also finds it easier to adapt to new techniques. Poor countries have the problem of lower levels of human capital. Better health reduces the number of sick days lost and the incapacity on the part of the worker. It hence increases the overall productivity of the person. Good health helps in enhancing level of education by increasing levels of schooling and scholastic performance. Healthy population is a type of human capital. It enhances productivity. On the other hand, higher income generating capacity facilitates an increase in the consumption of health related goods. Health is also affected indirectly via the improvements inherent in changes in lifestyle, a more intensive participation in the workplace, higher levels of education for the individual, all of which promote higher health levels through increases in volumes. Health policy. Health is an imperative factor of general policy measures of a government. The policy of health includes strategies, decisions, and actions that are undertaken to achieve specific healthcare goals within a society. The word policy envelops into it a broad range of guidelines, laws, approaches, prescriptions, and regulations. Within the health sector, policies can be of broad or narrow scope. Macro policies with far-reaching implications like primary health care, family welfare, health sector reforms tend to shape the demography of a country. These policies affect most aspects of health service delivery. Other policies may be of specific nature, address narrower issues such as immunization or the control of a communicable disease. This module focuses mainly on macro dimensions of health policy whose implications affect the whole health sector. Policies evolve over time under multiple pressures. Health policies are based on the empirical research, evaluation, and structured analysis. The importance of the health system. The health system encompasses all the possessions, organizations, and institutions that are devoted to producing health actions whose primary intent is to improve health. The four vital functions of health system have been defined as: 1. Service provision. They should be an integrated network encompassing both formal and informal service providers, whether public or private, both at the level of service delivery and higher up the chain of management. Resource generation. It includes the key inputs such as human resources, physical capital, and drugs and medical supplies. Financing. The volume and sources of financial resources available for the health system, together with the mechanism for pooling resources and transferring them to service providers. Stewardship. The role of oversight of the health system, or which falls to the government and encompasses defining the vision and direction of health policy, exerting influence through regulation, and collecting and using key data. National health policy. The primary aim of the draft of National Health Policy 2015 is to clarify, strengthen, and prioritize the role of the government in shaping health system in all its dimensions. It aims at investment in health, organization and financing of healthcare services, prevention of disease, and promotion of good health with the help of cross-sectoral action, right to use to technology, developing human resources, financial protection strategies, and regulation and legislation for health. The National Health Policy addresses the urgent need to improve the performance of health system. Taking into consideration the two-way linkage between economic growth and health status, this National Health Policy is a declaration of the determination of the government to leverage economic growth to achieve health outcomes. The National Health Policy of 1983 and the National Health Policy of 2002 have been the guiding force for the health sector in the 5-year plans and for different schemes. But with changing health priorities and consistent action over the last decade, we have almost attained the Millennium Development Goals with respect to maternal and child mortality. Maternal mortality now accounts for 0.55% of all deaths and 4% of all female deaths in the 15 to 49-year age group. Objectives of the National Health Policy: improve population health status via intensive policy action in all sectors, also to expand protective, promotive, curative, and rehabilitative services provided by the public health sector. Achieve a significant reduction in out-of-pocket expenditure due to healthcare costs and reduction in proportion of households experiencing catastrophic health expenditures and consequent impoverishment. Assure universal ability of free, wide-ranging primary healthcare services for all aspects of reproductive, maternal, child and adolescent health and for the most prevalent communicable and non-communicable diseases in the population. Ensure improved access and affordability of secondary and tertiary care services through a combination of public hospitals and private health sector. Influence the growth of private healthcare industry and medical technologies to ensure alignment with the public health goals, making healthcare systems more effective, efficient, rational, safe, affordable, and ethical. Enable universal access to free important drugs, emergency ambulance services, and emergency medical and surgical care services in public health facilities. Policy directions ensuring adequate investment. The policy envisages increasing the public investment in health to 2.5% of GDP. While this might seem realistic and pragmatic in keeping with the current levels of investment, no country in the world has achieved universal health coverage with such low levels of investment. The draft policy seeks to mobilize the additional financial resources through direct taxation, health cess, and sin tax imposed on tobacco, alcohol, and other products that adversely affect health. But there is no guarantee that these indirect taxes will not be regressive and exacerbate the condition of people already adversely affected. The levying of a universal health cess will also not be equitable. This would be morally unacceptable. Preventive and promotive health. Preventive and promotive strategies for health cannot work in seclusion and need to be linked to food security, water supply, and sanitation facilities. The policies lays emphasis on educational needs of adolescents for sexual and reproductive health, SRH education. The accredited social health activist, ASHA, or ASHA workers are voluntary and charged with responsibility of several of the health programs. The accountability of ASHA to the health system is not addressed. This gap needs to be corrected. Primary, secondary and tertiary health care services should be well connected through set of rules and transfer system. The policy is silent on oral health, rehabilitative and palliative care, replacement therapy, artificial organs. This gap needs to be addressed. Limitations of the health policy. The draft national health policy is silent on the need for adequate manpower with training to achieve comprehensive primary health care (PHC). Market-driven expansion will not fully attend to the requirements of appropriate training to suit primary healthcare needs. The growing evidence regarding poor quality of training imparted in some of the newly approved institutions calls for a review of the Medical Council of India's procedures for sanctioning. Policy pronouncement on the use of private sector for expanding access should not result in utilization of inadequately trained personnel as part of the program for comprehensive PHC. Therefore, the policy for procurement of services from the private sector should specify standards of care to be delivered. Currently, 50% of the expenditure of any health system is on staff. Facilities for recruiting staff for remote areas will need additional financing for monetary and non-monetary incentives. The possibility of increasing the proportion of GDP expended on health is doubtful as we have a low tax base. Government spending has grown slow in comparison to GDP in past 10 years. By spending just 2.5% of GDP, one cannot reach universal healthcare goal. Strategic purchase from private sector can also inflate and skew the public expenditure in health towards secondary and tertiary care at the cost of primary care. Strategic purchasing from the private sector is another suggestion for concern as most of the private players are located in the urban setting where most of the tertiary care institutions are located. The policy acknowledges that insurance mechanisms have been inadequate to meet the healthcare needs, but has not suggested strategies to tackle the same. The policy is silent on healthcare needs of the aging and elderly population. Therefore, this should be addressed through special provisioning. The policy needs to specify the mechanisms, both preventive and promotive care, which it proposes to regulate and evaluate the private sector in order to ensure accountability for public health goals. The policy has addressed the issue of electronic health records (EHR) or electronic medical records (EMRs) within the framework for privacy. However, the current public health requirement is for use of such records for early detection of global trends in health and healthcare use. The policy is silent on the need for cadre of clinical engineers to procure and maintain medical devices and equipment, especially in the second and tertiary levels of care. The role of building knowledge for health system research has to be seen as a shared responsibility with the private and not for-profit sector, which the policy is silent on. The policy is silent on right to health care. To achieve universal health care access, there is need to make explicit the type of entitlement that each one is going to have at the primary care and have a proper referral system. Summary. We can summarize the above modules as follows. Health population is an asset for the country. It is a vital component of human capital. The allocation of health resources should be done mainly to achieve the objectives of equitable distribution of an optimal level of health status and an adequate level of risk protection for all. It remains essentially the role of the government to finance and distribute basic health goods equitably, especially in the context of poor and developing economies. Macro policies with far-reaching implications such as primary health care, decentralization, family planning programs, health sector reforms tend to shape the demography of a country. Though the National Health Policy 2015 has covered many important aspects relating to health and healthcare, much remains to be done to provide good health to all.